Everyone. My name is Dipesh Deshmukh and I'm the Vice Chair of IBG. I represent IBG here. For people who don't know, IBG is India Business Group. We are a Chamber of Commerce, almost 7-8 years old now. So our focus is to help members in any way we can to seek business, to seek connects, to help with international connects in India. Our founder, president is Mr. Vikash Mittal Sen, who is an absolute master of networking. And he himself is the Honorary Council of Mali. So he's somebody who helps, mentors our members and goes out of the way to help us. Vikash, can you please say hi? So that's Vikash, he'll talk to us later. Guys, I'm going to put everyone on mute now. And I request people to turn off their videos. Only the speakers will keep the videos on, all right? So please turn off your videos. All right. Yes, so you met Vikash. I also would like to introduce you to our CEO, Ms. Priya Pansare. Priya, can you say hi to everyone?
Hi, good morning, everyone. And special morning to Ms. Gupta. Thanks for coming to our platform. And we've never had COVID discussion on this platform all this month that we've been doing webinar. So really looking forward to listening to you. Thanks a lot.
Thank you, Priya. All right, so it is, all right. So I also would like to introduce you all to Siddhi and Girish. They both are our pillars. They help our members in a lot of ways. They take care of our members. So thank you so much, Girish and Siddhi, for everything you guys do for us. We also have Gaurav Gupta, who helps us with our online, media promotions and stuff like that. So thank you again, Gaurav, for what you do for us. Very quickly, before we start the session, some ground rules. One, I have kept everyone on mute. Second, I have requested everyone to keep your videos on off mode. And if you have any questions, even during the session or whatever, kindly type the questions in the chat box below. So at the end, we will have a Q&A round and I'll ask your questions to Vandana ma'am. All right. Also, I've already requested that if you're not a member of IBG, please type your details, email address and phone number and name so that we can reach out to you with future updates. So with that, I would like to introduce our today's speaker, Mrs. Vandana Gupta. She's a cancer survivor. She's a fighter. She started a foundation called WeCare in the year 1994 to provide emotional support to cancer patients. She has won several awards for the work that she has done. She also believes that together we can and together we will conquer cancer. And what I love about WeCare Foundation's tagline is WeCare is a place where ideas begin and hope never ends. It's beautiful. So with that, Vandana ma'am, I'm turning over the mic to you. You can start your presentation now.
Good morning. And can I have the share screen, please?
Yeah, I have done
that. Good morning once again. And before I start the presentation, I would like to thank IBG for giving a platform to me to share some thoughts with you, which have been in my mind for a very long time. In fact, ever since this COVID pandemic came in. So as was told to you, I'm Vandana Gupta and I'm a cancer survivor. I had started my fight with cancer 27 years ago. And at that time, there was no Google, there was no way that I could get information. And so there was a big gap that I had to get information about the disease, about the side effects of the treatment and other things. So the support group was formed. The name was WeCare Foundation. And the idea of the support group was that we would give information to all the people who came in, who wanted to know anything about the disease and also about the side effects of the treatment. That was the main thing. And also financial support, emotional support, and psychological support to the patients and also their families and the caregivers. So the idea generated that we were the first support group in the country, almost the first, and we decided that we will work meaningfully and diligently with all our stakeholders, learning all the time and sharing that learning. So it was the patients, the doctors, the nurses, the hospital administrative staff, the individual donors, the corporates, charitable trusts, social organizations, NGOs, similar international and national organizations, and above all, its volunteers. So all of us, and we were always eager to learn because we thought that we could learn something from the doctors, we could learn something from the patients, and everything could be shared and made more meaningful. At the same time, we always wanted to emphasize the fact that cancer patients can survive, and survivorship was extremely important. With that in mind, we started the Cancer Survivors Day as our main event, as our annual event. The Cancer Survivors Day was an event where we were honoring cancer survivors, the caregivers, friends, and medical professionals. It was an opportunity that people who had cancer could live with the history of cancer and they could connect with each other. And also it was to support and recognize people who were during this journey going through the hardship and how they've come out of it. And also it was an opportunity for us to draw the attention to the challenge of cancer survivorship to promote resources, research, and survivor-friendly legislation. So something about WeCare, and now everything was going extremely smoothly till March 2020, at least in India. Though COVID started much earlier, but I know that in Mumbai, we were going to the hospital regularly till at least the 20th of March. So that's the time when COVID struck. Along with COVID came a lot of challenges. Now it was a new era. The treatment of cancer, whether it was chemotherapy, radiation, or surgery, all took a backseat. Everything took a new dimension. With the exception of Tata Memorial Hospital and a few other centers across the country, there was a total state of confusion. Either they were closed or the procedures were delayed. The patients were in a stage of confusion. Where would they go? Who would treat them? Was it safe to take treatment? How safe were the doctors? How could they reach the treatment center? Where would they stay? All these were problems that the patients were having. And above all was the logistic problem that patients who were stuck in Mumbai, how would they ever be able to reach home? Who will pay for the extra accommodation that they had not envisaged, or the food that they would have to spend the money on, and the uncertainty of when they would be able to go home. So all that was a huge issue which the patients were facing. And it wasn't like the hospitals we can blame, because from the government, 80% of the beds of the hospital were taken away for COVID patients. So the hospitals were short of space. The doctors were not sure whether they can come to the hospital or not. Patients were not sure of the availability of the doctors. And one thing which bothered all the patients was, what will be the physical condition of the doctors? Would they be COVID-free? There was no way for them to know. So would it be safe to go to the hospital? Because, every time they went to the hospital, there was restriction in the movement. The number of people who could go with them was totally restricted. So all this added to their fears, and they were like, is it a good thing to go? But at the same time, they need to be treated. So all the time there was, between one thought or the other. In fact, some patients mentioned to me when I told them that you must stop coming and not come here. And they said, Madam, either we will die of COVID or we will die of cancer. So it's an alternative to choose from. From the patient's point of view, they want to get that alien out of the body. Alien meaning the cancer cells. We and the doctors have always told them that early treatment is extremely important. That they need to go in for checkups, they need to come in for, because stage 1 gets treated faster than stage 2 and 3. So every time we tell them, God, no matter what happens in your family, whether there's a birth, there's a wedding, there's a celebration, please avoid all those things and just make sure that you are here for the treatment and that you come here on time. And now this advice was always in their mind, and they wanted to be like, they want to come. But here now we were telling them that everything has stopped, the world has stopped, and so you must not take any more treatment. Weren't we confusing them? I'm not sure, because like whether they're coming early made sense or whether their delay was a good thing to do. The patient was caught in that dilemma. Every time they would say, "Madam, आपने तो कहा था कि जल्दी आना, आपने कहा था treatment time पे लेना, अब आप बोल रहे हो अभी मत आओ, या doctors कह रहे हैं अभी आने की जरूरत नहीं है." So they were always confused about what was being told to them, and I feel that we had put the fear in the minds of the untreated patients that that you could delay your treatment and you could continue with in the state that you were in. So I don't know whether it was a good idea. It was difficult to assess their emotional and physical well-being, and this period of uncertainty definitely was affecting our patients. Now, because of the government initiative, most of the money that was being given to the NGOs to help and support cancer patients had been withdrawn, because all the money and all the fund was focused on COVID-19. The PM CARES fund started patients, and they were told that it would be considered as CSR money. So now the NGOs and other bodies which were helping patients financially also had to think about how they would be able to support patients. And then if we were to tell the patients that we don't have the money to support you, there was still more uncertainty, because at least in Mumbai, the patients who came were always confident that they would always be supported by money from the patients and the donors. So I think the physical and emotional well-being of the patients was greatly affected. The waiting period over here affected them adversely. And cancer was, cancer, we always say, if treated early can be good. If it doesn't get treated early, then it moves to an advanced stage, and then from the advanced stage to palliative care, which means a patient who could be treated well in time has now begun to move into a stage where he would probably not be treated ever at all. It would be just a symptomatic treatment that would be given to him. Surgery, which could have been done and could have taken care of, has been delayed because there may be COVID effects. So I felt that the cancer patients were being pushed to hopelessness. Somebody who could recover was now not sure whether he would recover anyway. That's why I think that sentence always rings a bell in my mind to say, "Madam, whether we will die of COVID or cancer, but I think our death is a certainty." So at this stage, I feel cancer treatment had to wait because COVID had taken center stage. So everybody was focusing only on COVID and nobody was focusing on cancer. I'm talking about cancer treatment because that is where I'm connected with, but I'm sure this must be the same for all other illnesses and diseases that were there. I have some statistics which were collected about 5 months back when the count of COVID was 300,000, and they said that COVID had killed 300,000 in 5 months. But just to tell you that cancer can kill about the same number in 11 days. So who has a greater potential to kill? It's for the doctors to tell us. But as the numbers suggest, COVID has the potential to kill, but cancer has a bigger potential to kill. We are hoping that COVID will go away. Some vaccine or some treatment will soon be found, and that will be the end of COVID. But what would happen to the numerous people whose treatment has got affected because of COVID? At present, all our energies are focused on something for which there is no known treatment, which is right, because you need to find treatment for things which are not there. But at the same time, can you ignore things for which there is treatment? So those who can be treated are not being treated because we are all focusing our energy on COVID, for which we have to find the treatment. Which brings us to the question, which is the big C, cancer or COVID? Can the emperor of melodies be dethroned by an unknown? Who will be the big C? That's a question which we all need to ask ourselves and also talk about it. I kept the presentation short so that I thought in case we could discuss and talk more, because this was the initial thought that I had in my mind. Why should we focus energy only on one disease and ignore others which can be treated? Why are all the resources being used for only one disease and others are being ignored? Just today I read that in the newspapers that I think 11 hospitals are now going to start treating other diseases. I'm glad that this decision has been made, but that's the thought. So any discussion, any question, anything that we can go on talking about, please, you're most welcome.
Thank you, ma'am. Thank you so much. It was so insightful, and a lot of things we did not know, you have told us. Guys, anyone have any questions? Kindly feel free to type in the chat box. Also, once again, non-members of IBG, kindly type your name, number, and mobile number in the chat box so we can share further webinar details. I'm just going to read. There are a couple of questions or comments. Wait, just a second. All right, so we have a message from Dr. Amjad Khan Pathan. Hi, Dr. Amjad, how are you? Hi, I am Dr. Amjad Khan Pathan, Head Clinical Pharmacology. Can my NGO become associated member of WeCare? I am working for cancer awareness in rural areas of Vidarbha, Marathwada. Till now, more than 35,000 cancer patients have been benefited in free of cost. They want to start palliative care unit at Buldan. Need your guidance.
Sure, anytime that we can do anything. As of now, I know everything will be online, so it won't be possible to go there physically, but whatever we are doing for palliative care, see, we have a program where which we are trying to continue even in these days, because we found that it doesn't help to stop giving funds altogether, and our donor who was supporting this program agreed to pay for the patients. So all the patients who are on palliative care, about 20 of them are enrolled with us, and we give them 10,000 rupees a month, which is like a way of keeping them healthy and the family to look after them, because as you know, for the poor people, even looking after somebody who may not live very long becomes a big challenge. So we give them that money, and fortunately for us, in all these months, in the 4 months, we have lost only 2 patients who have died their normal death, but the rest are doing well, and it's heartening to know that.
Very nice, very nice. So question for people who don't know what is meant by palliative care.
Palliative care is an advanced stage of the disease. Active treatment is not really possible. But I mean, I'm telling you from a non-medical point of view.
Sure.
But what they try to do is medicines are given to the patients are kept comfortable. But in a way that, disease, they try not to have the disease growing, and to keep the patient as comfortable as possible with the medicines and the resources that are available.
Okay, interesting. So what we'll do is, Girish, if you can type Vandana ma'am's details in the chat box, people can get in touch with her directly. Dr. Amjad Khan Pathan, you can take the details from the chat box so you can get in touch with Vandana ma'am. All right. So the next question, hope medical profession has specialized field of professional practice. How COVID can take over all minds of government machinery. Very important to be noted by one and all sensitive minds. It's not a question, it's a comment.
Yeah.
Yeah. So why not medical fraternity protested with their professional demand? That is the question.
Pardon?
Why not medical fraternity protested for their profession demand?
See, I don't think there was a choice really with the medical fraternity. The way things were, the government took control of everything, and their focus and priority became COVID. So, and anybody who was not listening to that is in trouble and cannot do anything more than that. So it's only some hospitals like Tata Memorial Hospital, I know for sure. What they've done is like they've also converted a ward into a COVID ward. They've taken some beds from the municipal body to treat cancer patients with COVID over there. And all the patients who enter the hospital are tested for COVID. They have a fever clinic, and subsequently the treatment is given to the patients. So it can be done. It's just the efforts also have to be made. I think Tata Memorial Hospital, the doctors have really put in a lot of effort to make sure that nobody gets affected. Of course, the numbers have come down because the time of lockdown, there were people who could not come to Mumbai. And so they had to do telecounseling, and they had to connect them to patients who were in their city or around their city where treatment could be taken. I think in Tata Memorial Hospital, there was a huge fall of the number of patients who were coming in because of the trains not working and the planes not working. But some were very enterprising, and they took a, like a taxi, and they drove from Pune or something to come to Mumbai. So that is how it was going on. But I think COVID, what I was trying to say is that, COVID has become like a big dragon hanging on the head all the time. So anything you do, the thought is only COVID. But we know that we can't do anything about it, but you always keep thinking of COVID. But in the process, you may be doing a lot of harm to people who have other diseases. And like I said, I can talk about cancer, that people are not paying attention to that.
And I personally believe that COVID has become such a big thing thanks to our media. Because if you say that more number of people can die because of cancer and COVID relatively is not as bad, our media has made COVID so big because they need something to show people, right?
Yeah, so like they were saying, the one day the media is an expert in COVID, the other day they are expert in political matters, the third day in the suicide that took place, so mental illness became a big thing, and the fourth day is the China war, which is a big thing now. So anything which is the thing for the day becomes a major thing for media, and sometimes that affects adversely the patients when they see that, and when anything that is being done is only being done for COVID, they begin to wonder, they are also scared. Is cancer bigger or is COVID bigger? Is any disease bigger or whatever, So people are not going for their checkups because of the fear.
Yes.
For any other disease. Like if you have a toothache, you can't go to a hospital because it's not safe to go to the dentists are not there, and it's not safe there. So can we live with like this? I compared cancer and COVID, but I think it can be compared for any disease.
Absolutely. All right. So our next question is, there are so many types of cancers, but their treatments are very limited. What are the new researches that are going
on? Being a non-medical person, all I can say is that most of the cancers can be treated and can be treated well. And as of today, there are research going on in every field where, and for every cancer. So there is a lot of scope for cancers to be treated, and that is why we keep telling the patients that the earlier you come for treatment, the better are your chances for getting recovered. So here again a dichotomy, because now you don't want them to come, and you said don't come here, just stay where you are, show your symptoms to somebody else, and you're creating that fear in the mind that, earlier we used to say, the earlier you came in, the better it is, and the faster you can get cured. Now you are saying, never mind, come after some time, as long as you are safe to come. So what do you do?
I know. And again, earlier they come for treatment, provided they get diagnosed in time, right? That's another issue. People have no idea.
Yeah, so now what diagnose also, because earlier we were doing a lot of awareness camps and awareness, various places we would go and talk about the various cancers and how you could come for checkup and all those things. Now all those talks have to have become like meaningless, in the sense we can't go and do it. So the little awareness that you could generate and you could tell people, that it is good to come in for your checkup is not being done now. So,
Understandable. So our next question is: are any treatments or therapy used for cancer? Can they be used for COVID as well? Because many industries are trying to do repurposing of drugs for COVID. So are you aware of any such thing?
see, I don't know, but just 2 days back, I read somewhere that they're thinking of using radiation. But but I'm not sure. But All India Medical Science in AIMS in Delhi is working on some project in which a limited dose of radiation may be used to improve COVID cases.
Okay, interesting. We have one more question. Can cancer consultation be done online? How effective it is if done?
Yeah, so I don't know if you heard of a system called Navya. Navya is a second line platform which has been developed by Tata Memorial Hospital and the National Cancer Grid. The National Cancer Grid is a body of various cancer hospitals and organizations across the country. There are more than about 200 people who are members of that, so that uniform treatment can be done and uniform guidance can be given, and uniform prices of the drugs can be fixed and all that. And this body has been there for about 7 years now. And so what happens is that if you send your reports to Navya, it's navya.org or Navya for second opinion, and depending on your ability to pay, I think it's zero for BPL patients and for army people, and it is about 10,000 plus whatever taxes for others, and you load all your reports. It's a very simple self-explanatory process, and then there's within 48 hours you get a report of whatever you want to know, and based on that they also nowadays are telling you which hospital you can go to, which doctor you can meet, and where you can consult. So that is how it goes, and there are other doctors also who are working in private hospitals, who are doing private consultations. You have to take the appointment with the secretary, and then on Zoom or something they can do the private consultations, because they want to see the patients and they do the consultations accordingly.
Yeah, unfortunately, it's not like orthopedic, right? When bone breaks,
Yeah.
the doctor has to touch you.
Yeah,
You
yeah,
a report and definitely.
absolutely, yeah, yeah.
Cool.
And bone surgery is something which requires a lot of hygienic conditions. So usme thoda bhi, if there is an infection, then it can create a lot of problem.
Correct.
So
It's better not to break bones right now.
yeah.
All right. So we have a comment from Dr. Renuka Desai. She says, have been treating cancer patients at my clinic without any medicine. Leaf therapy given additional to detoxification. 2 patients of breast cancer and a prostate cancer patient she has treated. So it's a comment there.
Okay.
What level of costs does a cancer patient has to incur for a typical cancer treatment? I understand specific cancers have become treatable. Which cancers are yet without any specific treatment?
I don't think there is any cancer which is without any treatment. Maybe the prognosis may not be so good in some cancers and may be excellent in some other cancers. There are many factors which determine your treatment, as far as I know. Your age, your physical strength, your immunity, your, at the stage at which your cancer has been diagnosed. All those things add up, and of course your willpower. The more positive you are, the better it is to it helps you in help your immune system to fight the disease. So there are many factors which can help you, but I think there are treatments for all type of cancers, and new treatments are being evolved for all other, like breast cancer, prostate cancer, and pancreatic cancers. All these cancers people are working on to get more. Just to tell you that when I was diagnosed, my disease was stage 3, and stage 3 was supposed to be not so good a stage to be in, but again I would say because I was younger at that time and because of whatever reasons I survived stage 3. So it doesn't really matter. I think it's more like listen to the doctor, do what the doctor wants you to do, and try and be as positive as possible.
Interesting. Very nice. Is any form of cancer transmittable to others like COVID is?
Not that I know of.
Another, I'm told international patients are coming to India also for treatment of cancer.
Yeah, they are. I mean, not now, not in the COVID days, but yeah, yes, of course, because our expertise matches international standards, and our costs are like negligible as compared to the international standards. So people like to come here for treatment, and they've been coming here, and they're happy to be here for the treatment.
Nice. My question is, which is more dangerous, cancer or COVID-19?
That's my question. Which is the big C, cancer or COVID? So what do you think? What does the audience here think? What is more dangerous, cancer or COVID? I don't know.
Don't watch news, then COVID is not as dangerous, okay?
See, I don't know because the only thing is, because of transmission, it is being passed on to so many people. So that is the danger part where cancer wins, because cancer does not get transmitted by touch. But and we unfortunately are so overpopulated that we are lucky to live in a room where I can sit by myself. But there are people who are staying like 10 people in a room and 15 people in a room, using common toilets, which is not so good to do, and they can't help it. But here I feel again, I mean, I know this is not the forum to talk about it, but it's not like something which has happened overnight. We should have been aware of this situation of like not giving them proper conditions to live in and making them do all the work that we were asking them to do. So today to start talking about those problems is we were sleeping all these years, and suddenly we've woken up to this problem. We always knew that people were living in a very bad condition, but we never thought of doing anything about it.
But again, see, if a lot of people come into big cities like Mumbai from smaller towns and villages, and they don't have a place to stay, they are not making as much money to live comfortably, then as we, meaning if you're saying government, what will the government do? I mean, they do SRA projects, they're making flats and giving to people who are in slums. So I think to a certain extent, this could be, looked after or helped. But beyond that, if 10 people are living in one room, it is unfortunate, but they are the ones who are coming from smaller towns, right? Now imagine how many people have gone back. That means all these people have come here and they cannot, and affordability in a city like Mumbai also is a challenge, right?
Yeah. So I'm not blaming the government or anybody, but suppose, for example, I mean, just a small thing, that if there's a person who's a builder and he has got people who are going to be working on his project. So along with the building, if he has place for the people, at least proper toilets and all that, then something is being taken care of, So to that extent is what I mean. I mean, and people coming also now have to take a decision whether they really want to earn this extra money and live in unhygienic conditions, or whether they are comfortable in the villages doing what they are doing there. Maybe the project can shift to, if they have the infrastructure, some projects can be shifted to the villages that people are living in, because we have enough land and the labor, both is available there. So
I agree. Again, but the decision of whether they should make their living in the village or come to bigger cities, the challenge is, imagine a field which the farmer is tilling. Now he has got 3 sons or 3 kids. And if all 3 are working on the same farm, they are still making the same amount of money.
sure.
So what they do is 1 or 2 boys go to bigger cities looking for a job, and 1 child takes care of the farm. So
Absolutely.
because even if their children, again, same size plot, same size farm, they are not going to make any more money.
No, and everybody has to make an advance in their career, because they have to move on. Like they have to go, I mean, our children from Bombay are going abroad. for the same reason, because they want to make a better, earning for themselves, better life for themselves. So everybody wants to have a better life. I agree with you totally. But the resources that we can give them, if it is possible, then it would add. Now this is like a, point where we need to think. Maybe when cancer came, we never had to think about these things. But now that COVID has come, we have to think about how to better the situation, how to, knowing that it is infection, knowing that the other viruses also which came in were a result of various type of infections. So we never bothered because those viruses went away and we were never in a lockdown situation. But maybe this is a more lethal virus. And so it is a point to think about what can be done or what should be done.
I agree. All right, so the next question is, meditation is major treatment for cancer, question mark. Is meditation a major treatment for cancer?
Well, I won't say it's a treatment aspect, but it is something which keeps your body and mind fit. That's the only thing. Whether it is meditation, whether it's yoga, it is something which relaxes your body. All the exercises in yoga where you do the breathing exercise, your lungs, so it helps you in dealing with situation better. And so the same exercises are being taught for the COVID patients also, because it helps in your lungs. And exercises like yoga nidra in the yoga stream is something which helps you relax the whole body. You are extremely tense, so either because of the disease or because of the circumstances of the disease, or because you don't have enough resources to take care of yourself. So if you are able to relax your mind for some time, I think it's useful. So I won't say that you don't have any treatment at all and just do yoga and meditation. You have to have your treatment. Along with that, you can do whatever way to relax yourself to become positive.
Interesting. And I'm sure meditation helps no matter what, whether you have cancer or no, or it definitely helps, right?
Yeah.
So we have an interesting comment from Rashmi Tipnis. She says, I'm a cancer survivor. My personal opinion is cancer is more dangerous. COVID can be avoided with due care, but no one can control over catching cancer. It's so true.
Yeah. Yeah, because see, cancer is something which is in your body. It's a misfunction of the cells which is happening. So your cells are breaking down, and anybody can have it because the thing is from inside your body.
Yeah.
COVID is something which is an acquired disease because of touch, because of breathing, because of the sputum, because of so many other things. So if you are taking precautions like the mask and the hand washing and other things, you can take care of COVID. I believe in Czechoslovakia now from 1st of July, they have said that masks will not be required. Maybe they feel that enough immunity has been developed and masks will not be required over there.
So a question, is there any regular checkup to ascertain the cancer? So to make sure they don't, you don't get cancer in the body for men or women. This could be a preventive intervention. So any tests that somebody should do?
In India, I can only focus on India to a large extent. Most of our cancers are related to head and neck area, which means, and these are because of our habit of eating pan, tobacco, bidi smoking, and cigarette smoking, and all those things. So if we can take, eating the kheni and zarda and all these things, pan masala. So if we can avoid these substances, then at least 50% of our cancers will be taken care of, which are in the head and neck region. But since we, we don't care about it, that is how the cancer incidence is so high for head and neck cancer. Similarly, another 25% are related to women's health, and so breast cancer and cervix cancer. So if we can, and we have found that people in the villages have less of the breast cancer and more of the cervix cancer. And that is because the unhygienic conditions that are there in the villages cause cervix cancer. And because of the hard work that they do, and the food that they eat does not get them to have breast cancer. Whereas in the urban areas, the women, the food that we eat is not the right type of food to be eating. It's it's like all wrong things, like too much of cheese and too much of butter and lack of exercise and all that. So we get more of the breast cancer. And since we are otherwise we maintain general good hygiene, so cervix cancer is less. So these are, if we can take care of more than 75% of our cancers, because which is in our hands, because of right diet, right way of living, it takes care of a lot of things. Similarly, obesity is a huge challenge. A lot of people, because nowadays they are doing sedentary work, obesity becomes a challenge, and that can again cause cancer. So doing exercise is extremely important. And also, we know that prostate cancer for men after a certain age is almost like a certainty. So if we can go in for our checkups, actually what happens is that we avoid going for checkups because of the fear of cancer, and because of thinking that, if it is cancer, then what type of thing. But if it is, what we have to tell them, that even if it is cancer, it is curable in the early stages. So
Yeah,
that
the
is
earlier the better, right? For any disease, for that matter.
for
especially
any
for
disease.
cancer, yeah.
Yeah.
So we have another question. This country needs 100 more hospitals like Tata Memorial. Why are other big industrial or business houses not getting into it? Or why is Tata not opening more similar such hospitals?
So I don't know if you are aware, but Tata Memorial has opened a lot of hospitals in various parts of the country. The Banaras, Punjab, Chandigarh, in Visakhapatnam, there are lots of hospitals which Tata Memorial has opened, and they are there. And also we have many regional cancer centers which are across the country. And most of the places have doctors which have been trained by Tata, who have gone there and who are working there. We have a huge Tata hospital in Calcutta, which is, of course, not on the lines of Tata Memorial because it's a private hospital, but most of the other hospitals are on the lines of Tata hospitals, and they are free hospitals. So if only thing is, that we are still conditioned to think that if we have cancer, then we must go to Tata Memorial Hospital. And that is how the load factor becomes a lot on the hospital. And the other hospitals are available. It's just that people don't like to go there, and that's all. But there are, but having said that, I still agree with you that many more hospitals can be opened and are being opened. Like Apollo has a huge chain of hospitals which they have opened for cancer patients. And like not only for cancer, they have for multiple things. And the hospitals are very good. Fortis has all that. Only thing is because of the expense. There is a huge issue because Tata Memorial runs on almost like a no-profit hospital, so it's possible. But so the patients find it convenient to come here. And another thing that I find that the patients like to come to Mumbai is because in other cities we unfortunately still don't have enough charity being given to the patients. In Mumbai, people don't have time, but they have money to give, and they are open to giving money to charities to help cancer patients. So they feel that their treatment can be funded if they are in Mumbai, but may be difficult if they are in some other city.
I agree with you. Is stress a cause for cancer?
Well, I would say that stress is a cause of cancer, but then all of us are going through stress in some way or the other, but all of us don't have cancer. So it's a very subjective thing, that some people can have a very like a short threshold for stress, and so maybe they can get cancer, but others can have a can put up with a lot of stress and still not get cancer. But ideally, I can't say, there's no research done to say that stress will definitely cause cancer, but it's a huge issue. And I think it's for everything, like a heart attack you get because of stress, you can get diabetic because of stress. So it's something like that.
All right. Mr. Ghanashyam Gupta is telling you, would like to connect with We Care Foundation with corporates for CSR funding for better cancer care in our country. Can we work together for such initiatives?
Wow, that would be great. That would be really nice. And either he can share his numbers with me or.
He has already shared his number. We'll send it to you. And
Okay.
Mr. Ghanasham Gupta, we have already shared ma'am's details, so you can definitely get in touch with her, write an email, message her. We have already shared Vandana ma'am's details in the chat box. I believe cancer is a way for mutation into other forms, like apes to humans, and so on in animals too. What do you think?
Well, I'm not a doctor to really be able to comment on that. Yeah. See, my knowledge of cancer came only because of my own cancer, and then working in the field of cancer in the hospital. And then since there was nobody else as a support group, the doctors were extremely nice to us because they wanted us to learn and be able to talk to the patients and be good to the patients about it. So I think we became like a good team. We became like the bridge between a doctor and a patient. Whatever the patients could not understand, the doctors would didn't have the time to explain. So we were there as a bridge. So whatever little knowledge I have, I would not like to comment on things which I don't know.
Of course. This is a very interesting comment. Cancer patients should be given free and fair treatment in each and every corner of the country without any bias. The only thing is somebody will have to bear the costs, right?
Yeah, see, in Tata Memorial Hospital, I know that they do this, that they have different categories of the patients, and those who are under the poverty line are given free treatment. So a large number of patients are given free treatment. Of course, it is supported by funding which comes from some other source. And some of the private hospitals have done something nice that suppose you are being treated at Tata Memorial as a private patient and there is a delay in radiation and you can go to another private hospital and those private hospitals will treat you as a private patient and ask you to pay what you would have paid in Tata, which would be subsidized. So some of them are doing these things, but I don't think, private hospitals can really do free treatment for cancer patients because, they work on a different model altogether. But yes, they do help out in many ways. But of course, Tata Memorial is a different so it's very different over there. But the issue that comes up over here is that not many people like to help people who are not below poverty line. And I think WeCare is the only organization which helps middle class patients to a certain extent. Because whenever we do speak to people to ask, to request them to give some funding for middle class patients, because middle class patients find it difficult to get funding from anywhere. And they may have insurance, but then that insurance is spread over the whole family. So if one family member has used up all the money, then the rest of the people will not get it. Or that they are shy to ask for money because they feel it's below their dignity to ask for the money. And also, like, sometimes what happens is that if one hospital is overcrowded and they go to, like, suppose if they're in Nair or like Sion or something, and they have to go to a private hospital because the delay in treatment would affect severely. They do go there, but then immediately the question is, why are you getting yourself treated in a private hospital? But the choice was not his to get himself treated. And so in the process, he might sell his land, he might, sacrifice his child's education or something like that. So if people can understand this and, support middle class patients also, I think at least as a city in Mumbai where we are so giving, that would be a really good thing to do.
Thanks for telling us what the genuine challenge is. And I think the middle class category is such that people feel they have their job, they are making money, so why support them? But at the same time, I know some people who have spent their entire life saving, sold their flats to be treated.
Yeah,
You know what
yeah.
you're saying. It's really
And you
treated.
know, it happens with the young students who've got cancer, and if they have to be treated, then it's a choice between what to do. You know, whether the treatment should be done because they still haven't started earning, and they know that the family cannot afford that money. So how do they get themselves treated? You know, so those are the type of challenges that come up.
So true. I'm going to take this last question because we are almost running out of time. Is cancer hereditary? If yes, then what should be the preventive measures taken?
See, I don't know whether one can really call cancer hereditary because, as far as I know, breast cancer is the only cancer which can run in the family, or some sort of stomach cancers, which were found, you know, in China and other places where people had more of them. So it was related to diet. And breast cancer also, they say that if you have breast cancer, then check out whether your daughters can have or your aunt had or something like that. But it's only 0.01% as far as I know. So whether we can call it hereditary or not, I'm not sure. But of course, genetic testing is being done to a large extent these days, and they have found some BRCA genes which can be common and which can be found and all that. But again, it's a controversial thing that we know of Angela Jones, who had got her breast removed because she had the gene which could give her cancer. Do we want to go through that at this stage? I mean, I don't know. It's again a dilemma whether you want to be treated for or removing part of your body just because there is a likelihood that you may get cancer. But as of I mean, breast cancer is one where we can say that there may be a possibility. Like I said, a very small possibility. But other cancers, I'm not sure.
Okay, all right, all right. So with that,
No, but before we close, we need to find out what is the bigger cancer or COVID. What would people like to type in or say, or does it make sense
so some
to?
people have already typed that cancer is bigger than COVID.
Okay.
Yeah, because there were comments I did not, but since you're asking,
Yeah. Okay. Sorry.
So before we end, I would like to first invite our CEO Priya to say a few words, closing remarks, and then we'll have Vikash over. Priya, over to you.
Thanks a lot, Mrs. Gupta. This was really an insightful conversation. Though you're not directly from the medical field, but the knowledge that you've given us is quite equivalent to having a knowledge from any doctor. So thanks a lot. So before we close, few updates on IBG. IBG is going international. We have tied up with a lot of international chambers, and we've been actively about to conduct virtual video chats with their members, so we can have possibly a B2B meeting in this coming future. So the people who are new over here, I would request you to become our members if you're interested. And also next week we have our members meeting. This meeting is only limited to the inner circle of IBG members. Here we do we give referrals to each other, and also we speak about generating business in different forms. So this is for the people who are new to this webinar, and nothing really. Thanks a lot.
Thank you so much, Priya. And I would like to invite Vikash to say a few words. Vikash, over to you.
Am I unmuted?
Yes.
Okay, first I want to thank Mrs. Gupta. This was really extraordinary, but I've heard her before and she's aware of that. My take on cancer is more on the commercial side. The medical fraternity is doing what they can, but India being a third world country, particularly in things like medicine and medical matters, we are still a long way off before this can be a universal social responsibility of the country. As she said, a lot of people become bankrupt because one of the family members has got it. So this is where the commercial side of the this fraternity, the business fraternity must come in. We need, according to me, at least 100 more Tata memorials to cover what is happening in India. So with that point, I'd like to thank you again. Let's just think about this, that what are the responsibilities of businesses? I mean, they set up such large businesses, but very few houses are getting into doing cancer treatment or hospitals. Thank you.
Thank you so much, Vikas. And once again, Vandana ji, thank you so much for giving us so much insights. It was really, really interesting to have this conversation with you. Thank you so much. And bye, guys. Have a great day.
Thank you for the opportunity, like I said, so that I could come and talk over here. Thanks a lot.
I'm glad. Thank you so much.